Hey, folks, if you want early access to episodes as they drop, click that subscribe button, join us, and together we'll fix the broken U.S. healthcare system. We'll see you on the next one.
Get ready to take control of your healthcare. Here's your host, Ray Cober.
Did you know early on that you wanted to be a lawyer, or is that something that kind of came later?
I think early on I knew I wanted to be involved in politics. When I became a senior in college, I was a political science major. I don't think I was ready for the real world.
Who is when you were a kid?
Right. But my cousin was a assistant DA in Macon, Georgia, and really had a lot of influence over my life. And so I said, let me go to law school.
Okay.
Maybe hone some of my skills and thoughts a little bit.
Right.
And it's a great education whether or not you want to be a litigator.
Yeah.
And while I was in law school, I had a number of internships that were related to government affairs, one with the ACLU in their Washington office, and got involved with some issues there. And I think I decided at that point, this is what I want to do.
The organization that you're with now, is the CEO the proper title?
Executive director.
Executive director.
Yeah.
And tell us, what is the name of the organization and what is the mission?
So we're called the Alliance to Save America's 340B program, or ASAP 340B. We came together about 2.5 years ago. Mm-hmm. And primarily, we came together because there were two groups that wanted to start the motion of discussion about addressing some of the problems that were emerging from the 340B program. Pharma and the National Association of Community Health Centers. Mm-hmm. And so they started having discussions, primarily because the hospital community did not want to talk about this program. They didn't want to see any changes. Mm-hmm. They didn't want to talk to pharma, and they didn't want to talk to the clinics either. So the two groups, being kind of strange bedfellows, which happens a lot in politics, they decided to talk to each other and reach out to some other groups to form this coalition. We started out with 15 members of our coalition. We now have 36. We continue to grow. I'm sure by in the next couple of months we'll be up to 40 members, mm-hmm. and we'll still continue to grow as well.
What types of members?
We've got different types of groups. We've got provider groups. We've got consumer groups. We've got groups that are focused on aging. We've got groups that are focused on kind of issues related to people of color. It's a real diverse group that we have. Mm-hmm. We have nurses. We have physicians. We have the National Consumers League that represents consumers. Mm-hmm. It's just a really wide variety.
So it may help if we back up a little bit and talk about what 340B is. And, it's crazy. I know 340B pertains to legislation, yada, yada, yada. We use numbers and these, arcane descriptors. In plain English, what was the 340B plan designed to do? I believe it was introduced in 1992.
Yeah, it was introduced in 1992, but the issue itself really kind of started before then.
Okay.
So there were manufacturers that were providing hospitals drugs at a discount price voluntarily. Mm-hmm.
Okay.
And that price was hovering around 9% or so of the market price for the drug.
Mm-hmm. 9% of.
9% of.
So if a drug was $100, they were selling it for $9.
That's correct.
Okay.
That's correct.
Wow. That's a deep discount.
That's a very, very deep discount. So in 1990, the Congress passed the Medicaid drug rebate program.
Okay.
I was actually at another organization, Medicaid Health Plans of America at the time. And so the drug rebate program was designed to provide a rebate for drugs in Medicaid, and those drugs primarily were controlled by Medicaid health plans, Medicaid health insurance companies.
Mm-hmm.
Unfortunately, the way the statute was drafted, the effect of certain language in the statute actually made that price that hospitals were receiving a discount for quadruple, up to about 32%. And so 2 years later, they passed this 340B program to try and address that correction and add other types of covered entities that could receive discounted drugs under this program. So that's when the program was created in 1992.
So your organization primarily is focused then on what?
We're focused on reforming the 340B program. We've got 10 policy principles that we've adopted as a coalition, including some of the things I talked about.
Yep.
And they're really kind of based on clarity, transparency, and accountability.
Okay.
We think they are very reasonable. We draw a lot of our policy recommendations from what other types of covered entities are already doing, what clinics are already doing in many, many cases.
Yep.
And we think they're very reasonable. Now, if you talk to the hospital community about that, they have a different opinion, obviously.
Yeah.
But understand, I mean, both manufacturers and clinics have relationships, with hospitals.
Sure.
On a day-to-day basis.
Sure.
But I think they want to see clarity, transparency, and accountability in this program.
What does that even look like, Thomas? If we're talking about your little old organization against the hospital systems, I know for a fact that two of the biggest real estate owners in New York City and Manhattan are NYU and Columbia.
Yeah.
They own a tremendous amount of property.
That's right.
That's primetime real estate. They got to be worth a couple of bucks.
Right.
So as impressive as your background is, you're one kind of small little entity, not meaning to disparage you in any way, going up against these juggernauts.
Yeah.
What does it look like on the Hill when you show up and you you look over there and you have these monsters that have a different point of view?
Well, I think that's why we focus on those three areas. It's really hard to make an argument against transparency. I mean, that appeals to the average person.
Good point.
Whether you're in healthcare or outside of healthcare.
Yeah.
And understand, this has now grown to become the second largest prescription drug discount program in the country. Okay, so this is not a small program anymore.
Yeah.
And literally, I've talked to audiences that are not in healthcare, and they want to know how these dollars are being spent.
Right.
Especially at a time when now, there's been a bill that's been passed by Congress and signed by the president, and a lot of entities need to look for ways to find more money so they can spend it on healthcare, not capital improvement projects or things of that nature, but they can spend it on healthcare. And, 340B may be a place where you can find some dollars to spend on healthcare and not things that don't relate to healthcare.
How does it impact business? Does it impact business? If I'm listening and I'm the CEO of American Express, do I have an interest in this?
Yeah. In fact, there was a group of 25 large corporations, including Bank of America, and other groups called the Global Council on Aging. And they actually just released a report talking about how the lack of oversight with regards to the 340B program is affecting the business community. The American Benefits Council released a similar report in February of this year because private employers are also affected by the lack of transparency and oversight as it relates to 340B. Not only are Medicaid and Medicare being charged these 500 to 1,000% prices.
Which is astonishing.
But private payers are being charged as well.
Right.
And so that affects employers. I just talked to the A. Philip Randolph Institute, which is an organization that represents kind of African-American labor.
Mm-hmm.
And they've come out with a statement asking for reform of the 340B program.
Oh, wow.
2 years ago, they weren't there.
Right.
I spoke to them 2 years ago.
Right.
And last week when I spoke to them, they now have a position as it relates to 340B reform.
Okay.
So that's labor and that's a business community recognizing the impact in the private market.
All right, that's a wrap. Hit like, follow, and subscribe, and we'll catch you next time.